Everyone, this is Gretchen Swanson, and today we have Miles McNeeley coming back to us. He was here before on the show, and we are in a very troubled time and very unsettling. A lot is going on. We say that, but it is. And here is the connection. Miles is going to be addressing the ongoing fraud and scam environment that we live in, but also connecting it to COVID-19 and the vaccination rollout. So we're going to connect those two dots. So excited that Miles will be joining us. So stay tuned.
My name is Miles McNeeley, and I work for a nonprofit social service organization called Wise and Healthy Aging. We're headquartered in Santa Monica, but we're all over the county. We do have an office locally in Long Beach, which is where I'm based. I manage our elder abuse prevention programming, as well as a case management program that serves victims of crime and survivors and victims of elder abuse. The kinds of services we provide in that program include case management, counseling, legal advocacy, and crisis intervention.
I wanted to just connect back to when you and Debbie were here a couple of months ago now. We talked about the elements of how to spot a fraud or a scam, and those elements are just repeated over different topic areas. So whether it's trying to get, some relationship going, or get provide free money, which there's no free money, and that was well received.
Good.
So
Good.
I'm wondering, over the holidays and with the amount of social turmoil and continuing vulnerability that we all of us feel, have you experienced, or are you hearing that there are more incidences of fraud, not the intention, we know they're out there 24/7, but that people are responding to, just in general, scams? What's your sense of that?
Yeah, anecdotally, I'd say that there is an increase based off of the requests for information we're getting, although we don't have the data just yet to say for sure if there's been an increase. But it seems like it's something that is on the forefront of a lot of people's minds right now, and there's been an increase in the concern, at least.
So how do they, if we were to personalize it, just sort of take the modal person, how are they experiencing this time when they're responding to, or they're concerned about, fraudulent behavior?
So I think, as you mentioned, there's just so much going on, especially in the past couple of months. We think about the holidays and all of these different transitions that we're seeing in the world. Uh, People are feeling overwhelmed in a lot of different ways. And I think that scammers are very much aware of that and are going to be taking advantage of that. So the ways in which these kinds of concerns are brought to us, they're varied. Uh, in our program, we do a number of presentations and talks throughout the county of Los Angeles on how to identify scams and what we can do to protect ourselves, what to do if we realize, oh no, I made this mistake, I shared some information, I sent some money, what we can do at that point to address what's happened. We also do case management, and so we interact with the public in that way. We get referrals from adult protective services and other organizations, including law enforcement. And when we interact with the community, people are really interested in sharing their stories and also sharing their strategies, of what they've been able to do their own research to prevent themselves from getting caught up in something that's fraudulent.
So can you share a couple of those solutions that people have come up with?
Sure, yeah. So one thing, and I love doing these talks with communities and asking for a lot of participation because I do learn so much every single time I do discussion. And the scam world is evolving and the response to scammers is constantly revolving. Um, People have been sharing more and more phone applications that they're using that will automatically block robocalls. And I'm hearing different experiences. Some people say this app works better, this one doesn't. But historically, people, the best practice was to screen phone calls, let them go to voicemail, just don't answer the phone. And then as people became more tech savvy, people started blocking or learning how to block phone calls on their cell phones and or creating a contact list that would say scam call on it so they knew not to engage with the scammer. And now we're evolving where there's all of these different applications that are going to block out robocalls and telemarketers. There's different features on these applications. And so now that seems to be where people are headed to now. This is more
The people are the recipient of the scam or the scammers themselves. So when we say
great question. The recipients of the scam. So
Yeah.
these are members of the public that are sharing what's worked for them in terms of being able to keep themselves safe and keep their loved ones safe.
So with that, I'm just going to say to our listeners and our viewers today that at the end of this program, we're going to give a couple of important slides. What not to do, okay, or really what the slide is going to say is these are the conditions where you can spot the fraud. And we'll probably share some of that throughout. And that's specific right now to COVID-19 and the vaccination rollout. But these are general principles, and I think Miles is talking about that. Just creating a barrier between scammers and you via the phone technology. And then what to do. So we'll be sharing for those interested in getting information about the vaccine and the vaccination rollout here in Long Beach. There is a number to go to. And there's an online portal, and we'll talk a little bit about that. I know people have a bit of frustration, but we have 500,000 people in the city of Long Beach, and they can't all be vaccinated all at the same time. And we kind of understand that, but that doesn't mean that we aren't frustrated with the process. And that's just our world. So welcome back. And today we're focusing on COVID-19 issues that are in the scamming world, the fraud, as Debbie has taught us, is that fraud and scams are just another word for theft. People are stealing something from us and they shouldn't. But we're going to be talking about COVID-19 and the vaccine and the vaccination rollout. And so this is another angle that people in the fraud world that work 24/7 can try to grab something. So can you lay that out, Miles, sort of the conditions that they are finding and why fraud and folks involved with fraud might be successful?
Yeah, we oftentimes see that there is a strong emotional component to to fraud and scams, these random communications and contacts. Oftentimes, a scammer is wanting to use a sense of fear or anxiety or stress to help them connect with somebody and to engage with them and then to carry out their fraudulent activity. And as we know, these times are so stressful with COVID. And in addition to the stress and the different losses people are experiencing, there's so much change with the health policy and the health information. And I think people are feeling really inundated and overwhelmed to an extent with all the information around COVID. And the people that engage people in scams are aware of that. And it's helpful for them for there to be this confusion so they can kind of help even confuse the process a little bit more. And so what we're seeing is people are being contacted by people claiming to be involved with the COVID vaccine rollout in one way or another, claiming.
No, that's good. So let's take a moment to pause. So people feel vulnerable. There's confusion. There's a lot of different information. We hear something on cable news and we hear something differently from a family member. So there's a lot of unknownness, uncertainty, and then you get a call, or then you get some connection with someone who's going to potentially steal from you in some way. So what are the types of things that have thus far that we know today at the end of January 2021, what are some of the types of COVID-19 and vaccination fraud that you've seen thus far?
So if we go back a couple steps, what we were seeing initially was a lot of people claiming to be able to sell a COVID test, like a home test that you take at home, and that'll give you the results. And those were fraudulent, especially in the beginning months. There was only one test approved. It had to come through your healthcare provider. So if there was somebody outside of your primary care office advertising this, then it was clearly a fraudulent scam. Then there began to be these contact tracing scams where people were claiming to be contacting folks from the health department or from some health agency saying something along the lines of, you've been exposed or you may have been exposed to somebody that has COVID-19 and we want some information from you, so this will help our public health efforts. And now that
I just want to clarify. So someone would approach you asking for information.
Yeah, and when I say approach, I usually by phone for that specific kind of scam. Okay. For the contact tracing, somebody getting a phone call or a text message. So if it were me, I'd be getting this text message or this phone call saying, Miles, you've been exposed to somebody, and we want to be able to track this. This is part of our public health response. Can you fill out this form, or can you call me back and answer these questions? And then what happens is I end up being asked questions about some identifying information, maybe my social security number, for example.
So that's what's really key, is that the person contacting you, one, they know your name. They probably will try to identify you through your name. And so that's off-putting because you think they know you when they don't. But then they are going to the secret in there is that they're going to ask for identifying information, and that's a no-go. So none of these legitimate agencies are going to initiate that contact through the phone and then ask you for personal information. Is that correct?
That's correct.
Okay.
Best practice is just not to share information with anyone that's contacting you, and that contact wasn't initiated by you in the first place. And the idea is that once they get that information, they're going to be engaging in identity theft.
So welcome back. And there's a lot to remember because we want to be social and connected, and yet we have to have our guard up at the same time. So at the end of this call, we're going to, again, remind you of things not to do or to pay attention to, and then also things to take action around getting a vaccination or more information if that's what you need. And now Miles is, I'm turning to you, Miles. You're my go-to person on this. What are some of the things to watch for, to spot in terms of fraudulent vaccination signups, or what is that world that we need to avoid?
Yeah, there's a couple of key red flags. First of all, you don't need to pay any money. So if somebody is contacting you saying that if you make this payment, then we can put you higher up on a list to get the vaccine, or we'll just get you in the door right away, that's a huge red flag. It's a scam. Secondly, which is on the same lines, is that there's no way to get the vaccine early. So the way the vaccine is being rolled out is if you are in a certain profession, if you're in a certain age group, then the vaccine becomes available to you. And there's nobody that can change that. The procedures around that are very strict, and it would be illegal for providers to start giving out the vaccine before schedule.
Let me just jump in there because this has come up, and I don't, of anything that we can be secure on, we're secure that there's limited vaccine, and we're secure that those vaccines are only going into the approved group, and that people are getting fined for trying to do it otherwise. So there's a lot of attention to this. So there's vaccines, they're limited, we know that, but the distribution is by age or by work group or some other known identity. Is that correct?
That's correct. And there's one other piece of information I really want to be clear about, because we've talked about identity theft. And that's certainly something that can happen with these vaccine scams. But there's also the risk of just sending money. And by sending money, that means sending cash, giving a credit card number, sending gift cards, wiring money through Western Union. These are all really common ways in which we see scammers collect funds from people for their fraudulent activity.
So yes, and that's the point that Miles, the person that is connecting to you that is a criminal, they are trying to get money or access to your money. So money directly or access to your money, that's what they want. And we want all our viewers and all our listeners to keep their money, one. And two, we want them to get vaccinated if that is what they want. So people are working through that understanding of the vaccine and the vaccination process. So we totally appreciate that. Any other thoughts that you think help us, because we'll be in this for several weeks, if not a few months, and I want us to have this guidance?
Yeah, I think that when somebody is contacted and is not solicited, a really good practice is to sleep on it, to consult with somebody. Also, a big picture kind of way of looking at this is that it's really unfortunate that we don't have all the support that we really would want to get people the vaccine, in terms of the staffing from public health professionals being able to call each person directly and help guide them through the process. You mentioned the size of our city. We do have a fairly large city, and we just don't have those resources. So if somebody is giving you that very one-on-one attention, Miles, I want to help you get this vaccine, that's also a red flag because we just don't have that capacity yet to provide that level of service.
Miles, that is so important because I'm in all these meetings and there's just no infrastructure. And the health department here is doing just an amazing, laudable job, but there aren't people to call everyone individually, but there are some ways to get further information and to sign up for a vaccine. And we're going to give people that opportunity. So with that, I just want to say thank you. You are our repeat participant guest here, and we are just so no, that I am awed by that. And with that, we're just going to say goodbye for now. And this is super.